Welcome to the Rim Break Rodeo. We hope this video helps.
You start now. Wash the area with a gentle, non-comedogenic cleanser to remove oils and debris. This reduces irritation and prevents infection. Once done, press a cold compress or wrapped ice for 5–10 minutes to constrict vessels and flatten redness. Next, apply an alcohol-free antiseptic or calming toner so the skin stays clean. This step cuts swelling and lowers the chance of scabbing. Make sure to be gentle, pat, do not rub, and avoid makeup for at least a few hours. Once swelling has eased, treat inflammation directly. You can use a pea-size amount of 1% hydrocortisone for up to 3 days to reduce redness, only if skin isn't broken. After 24 hours, make sure to introduce a gentle enzymatic or chemical exfoliant, 0.5 to 2% AHA or BA, to accelerate skin turnover and fade marks, but avoid physical scrubs. When the area is closed and calm, switch to silicone gel or a vitamin C serum to promote collagen remodeling. To finish, hydrate and protect. Use a non-comedogenic moisturizer, then apply SPF 30+ every morning to prevent post-inflammatory hyperpigmentation. Make sure to avoid picking or peeling. If a scab forms, cover with a sterile bandage and let it heal naturally. Once healed, use nightly retinoid or gentle brightener to smooth texture. Troubleshooting tip. If you see worsening pain, spreading redness, pus, fever, or sustained heat, stop home care and consult a dermatologist immediately. These are signs of infection or complications.
Thanks for watching. Consider subscribing if we helped you.